Great, thank you. Esther, thank you for joining us.
I'm delighted.
If you don't mind, I'd like to ask you just 2 or 3 basic kind of yes or no questions that I like to ask everybody I interview at an event like this. I forgot to with Jesse, but I will with you. Is that okay?
So this is like genetic stuff or what?
No. Just basic sort of introductory questions.
Okay, sure.
Have you or has anyone in your family ever been involved in the building of a nuclear rocket ship?
Yes.
Yes. Okay. And then have you ever yourself experienced zero gravity?
Yes.
You have.
Mm-hmm.
Okay.
It's great.
Is it? I'll bet. And then really the last question is, have you ever, and this is just, we ask this of everyone, have you ever gone through cosmonaut training?
Yes.
You have?
And I passed.
And you passed. Good. Good. Well, if all of those things are the case, then I really feel comfortable moving forward. Can we do that?
Yeah.
All right. So you, like a lot of people here, are fairly remarkable, and not everyone here knows you. So I would be grateful if we could sort of start at the beginning. Could we do that?
The log cabin.
Sure.
Yeah.
Where did you grow up?
I grew up mostly in Princeton, 1 year in La Jolla, which was when my father was designing and building the nuclear-powered spaceship. 1 year in London when I just, sort of in agreement with my family, went to live with another family in London that were my dad's friends. Then I left home at 15 and went to college, but it's a little premature, so I took half a year off when I was 17 and went to live in Morocco with my boyfriend.
Okay.
But I ended up graduating when I was 21.
Okay. Your mother, a mathematician, and your father, Freeman Dyson, the physicist.
Right.
So you had sort of a normal, sort of average
Yeah.
kind of upbringing. And
We felt very normal. That was
Yeah.
the nice thing about it.
That's good.
Yeah.
It's all relative.
Okay.
That's sort of a physics joke. I don't know.
Yeah,
So then you went to college,
Right.
right? You went to Harvard, and you studied.
Well, I worked
economics.
on the Harvard Crimson, and some people dream that they haven't studied for a test. I dreamt that it was the end of term and I couldn't remember which classes I was in because I had never gone. And that was pretty close to reality. But I managed to graduate. It was great. And then I started my my real education a couple of years later when I became a reporter for Forbes.
And what kind of work did you do at Forbes?
Well, I was doing fact checking. So, and of course you couldn't go check things on the internet. You had to go look through musty files.
Because the internet was still on paper then, right?
We certainly didn't know.
It was a joke. It wasn't on paper because it was computers. I mean, it's the internet. I'm just kidding.
No,
I'm just kidding.
It was actually in somebody's
No one
drawings.
laughed at the internet on. Sorry, go ahead.
It was in somebody's drawings on paper.
Yeah.
But so we would call people up. We would call PR guys with this rotary dial telephone, and they would send us things in the mail. And if you could come up with your own story idea, you could go do stuff on your own. So I went to visit a coal mine in Montana. I went to see the Lance Biscuit factory in North Carolina and watched biscuits come off not exactly in a production line. I interviewed the chairman of American Motors, who offered me a test drive of a Pacer, which I had to refuse, not just for ethical reasons, but because I don't know how to drive. My dream is to fly in a spaceship and come back and ask for a driver to get me home.
Can you draw a line for us between being a fact checker at Forbes and being this person who is so heavily involved in innovation and the forefront of healthcare, who dreams of returning from space to get a ride home?
Yeah. Being a fact checker, I think, is the best training for almost everything, because it means you need to be skeptical. Mm-hmm. You need to be not afraid to ask dumb questions, like, well, why can't insurance companies pay for prevention since, as Dean Ornish proves, it's actually cheaper in the long run? And I've got the answer for you on that later. But it's just, my whole life I've been asking more questions. And when I get the answers, there's this wonderful saying in math class where the professor says, the remainder of the proof is left as an exercise for the student, which means I've done the hard part now, kids. The implementation is up to you. And I like the remainder of the proof, the beginning of the proof part.
So, what are you doing now?
Well, now I'm on the board of 23andMe, which does direct-to-consumer genetics. I am involved with a number of other, not health care, but health startups, such as Patients Like Me. You heard Jamie yesterday. Yeah. Organized Wisdom. You heard about Unity Stokes from Organized Wisdom. I regularly wear a Fitbit. And this morning I went swimming in the health center here, and I walked 1.92 miles by the time I got here. And I monitor my sleep with the Mayo sleep monitor. And the coolest thing, I was in Finland. No, sorry, I was in Denmark, but I met some people from Finland. And let's see if it will turn on. I've just started using it, so I'm not completely adept. But it'll turn on in a moment. I'll keep fiddling. These are light-emitting earplugs, and they are designed to help you deal with seasonal affective disorder, which is the depression you get in the winter if you don't get enough sunlight. And it occurred to me that they would also be really good for the miners.
In Chile?
Yes. There. Now, let's see if they hit the camera. So you can, there. And they're approved in Europe, not yet in the US, for the specified purpose. But I think they're way cool.
Of seasonal affective disorder.
Right. And I use them for jet lag. And one other, not a joke. There's also a program called Text for Baby in the United States, which was started by a company called Voxiva, is now being supported by Kathleen Sebelius and a whole lot of people. The idea is a woman signs up on her cell phone and SMSs back and forth. When's your baby due? How much do you weigh? Are you still smoking? Is the baby kicking? And this goes into a computer. If her answers are out of range, she's sent to a clinic, or the health insurer that signed her up for the program gets involved. And I'm trying to make that happen in Russia, which is slightly complicated, but we've got interest from the cell phone companies and so forth. And the other thing I'm trying to do is start an honest, reliable, credible clinical research organization that would perform drug trials in Russia, because that would be a huge blessing for them.
Yeah, it would.
So I'm basically retired, and I sold my company a few years ago.
Sounds like it. So what? So you have interacted in a variety of ways as a philanthropist, as a board member, and as a creator of
an investor.
An investor, certainly
Yeah.
as an investor in a lot of different kinds of companies and company models. Across that breadth of experience, and now being able to kick back in retirement and look back on it all, how would you characterize, regarding healthcare, the business model or business models that seem to have the most promise as you look ahead?
Yeah. Well, so very briefly, I see three markets. There's the market for healthcare, or what Dean correctly calls sick care, which is a huge market, includes Mayo, hospitals, pharmaceuticals, clinics, treatments, therapies, and of course the insurance companies and other intermediaries. There's the market for bad health, which is high fructose corn syrup. The Lucky Charms they feed children at school. I read in USA Today, that's tragic. alcohol, recreational drugs, driving your car when you could be walking, all these kinds of things. It's a huge market and lots of advertising for all these unhealthy things. And then finally, there's the market for good health, which barely exists. It's sports equipment, health clubs, but now it's beginning to include, if you like, advertising for good health, where people actually pay almost for the advertising and the devices like the Fitbits. And the first wave of people is going to be individuals just doing it for themselves, health nuts and people who come to this conference, that kind of person. Then you're going to have employers like Cisco. And as Sharon said so eloquently, we're looking for a financial ROI, but the real win is that our employees feel loved, they're more motivated, they want to work here. We don't actually need the numbers, though we find them useful, probably especially in meeting with our CFO. And then the third set of payers is going to be people like insurance companies and so forth and so on. But they do want the data because they've got beady-eyed CFOs and shareholders. But even with the data, there's a problem. I was at a meeting not too long ago where Walter Isaacson was interviewing Ron Williams, the CEO of Aetna. So being a fact checker, I innocently asked, when you do your actuarial calculations and do things like set off the cost of prevention versus the returns, what's your assumption of the average length that a customer will stay with you? And somehow we didn't get an answer. And I was in the audience, so Walter moved on, and there wasn't much I could do. But this is the big problem. For the insurance companies, they're not necessarily going to get the benefits. Cisco will get the benefits. As Sharon mentioned, they have a pretty high retention rate. Insurance companies, not so much. So I think the solution is going to be something that has a really bad name, and you could call it innovative or not, but it's derivatives of patient populations. So you get a patient population, and using all the record keeping that we have already, you follow this population, and the insurance company that paid for the prevention in the early years gets the rewards of it in the later years, either by selling the rights to this patient population, which will be healthier, or you do various financial mechanisms to make sure that the people who paid for the prevention get the rewards of it later on, including, of course, the individuals themselves. That's kind of complicated, but I would really like to talk to Dean about it, since he talks to Obama, because you need that kind of tying of the benefits to the early investment to make this all happen. And it's so clear that it works.
I could stay here and keep talking to you all afternoon.
But you have a 5-minute
Well, and there are a lot of
shift.
other people who are waiting for us. Will you stay here with us and answer some questions after we go to a break now?
Absolutely.
If you go into space, I'll give you a ride home.
Thank you.
Thank you. Let's take a break. Thanks.